How can you achieve and maintain business growth? Harvard Business School Executive Education is now accepting applications for a new program, Driving Profitable Growth. Taking place in Boston from October 25th through the 28th, this program focuses on business expansion and organizational growth strategies that can lead your company into the future. Learn more about this 3-day program for senior leaders by visiting hbs.me/growth. That's hbs.me/growth.
Blog Talk Radio.
Well, hello, fans and followers. It would appear as though it is a lovely, balmy, I want to say 20 degrees here in Wisconsin on a Friday afternoon at noon. Thanks so much to everybody who's listening in, and I want to say a special thank you before I even start the show because I know Dr. Rapaport is holding, so we don't want to keep him too long. I just wanted to very quickly mention a couple of things. Reminder to all filmmakers, screenwriters, etc., that for my film festival, the regular deadline is mid-March, which is approximately about a month from now. So to those of you who have not looked yet, have not seen it yet, still want to get to submitting before the cost goes up one final time, Art is Alive Film Festival 2017, Producers Club, June 23rd to the 25th in New York City. It is on Facebook. If you go to my Facebook page, which just says Art is Alive Film Festival, you'll find on there the Film Freeway Connection, in which case you can just click on the link, go ahead and submit your materials between now and, like I said, the next month or so. Second of all, just want to send out a huge shout out to Alexa Bigworth, which is yesterday's client that I had on the show. I have to say thank you so much very publicly because she put up a very large toast in a very public place this morning saying such wonderful things about myself and my show. So Alexa, from me to you, I cannot thank you enough for your kindness, your generosity, and your time yesterday. It was greatly appreciated. Without further ado, I have an absolutely wonderful client coming on the show today. His name is Dr. Jeffrey Rapaport. We're going to be talking about cosmetics. We're going to be talking about hair. We're going to be talking about replacement, skin, all that good stuff. He's the doctor with the know. So without further ado, I'm going to get him on the line and we'll begin talking. Good morning or afternoon,
Hey.
Jeffrey.
How are you, Cindy?
I'm very nervous. You're a big deal. Anytime a big deal comes on the show, I get nervous. I'm like, he's a big guy. Like, you're really important.
I wouldn't go that far.
I would go that far. I've read all about you. I know lots of things, and I've researched you, and you've done some amazing things. You've been to some amazing places. So there's lots to talk about. And I kind of want to jump around a little bit. We'll talk about your personal side of things, and, of course, obviously we'll talk about some of the things you've implemented through your practice. One of the things, the main things that I want to start talking about are basics, meaning that obviously we all have skin. Obviously we all have various different skin issues. One of the big things that most of us never think about, and I have terribly dry skin, so I'm the first person to ask this, there are certain factors that affect how your skin performs. For instance, things like stress or dietary considerations. If you would please, talk a little bit about some of those unknown things we don't notice that can cause a huge impact on how well our skin is taken care of, or how it affects our skin, rather.
Before I go to the unknown, I want to go to the most well-known, and that is sun. And people don't realize that sun affects all aspects of the skin. So if you do not respect the sun, and you do it from a young age, do not use your sunscreens, do not stay out of the sun when it's brightest between 10 o'clock and 4 o'clock, all the other things that you want to try to do to improve your skin are not going to work as well or even come close to protecting and respecting the sun. And the recommendations are to stay out of the sun between 10 o'clock in the morning and 4 o'clock at night. Do never sunbathe, never go to tanning parlors. They found that if they can keep young adults out of tanning parlors, that they can decrease the incidence of melanoma tremendously. So tanning parlors and the sun are the number one thing to keep your skin looking good. The beauty of skin is that it can repair itself, but if it keeps getting damaged, it's not going to do well. The second thing that I would tell you about is smoking. Smoking is terrible. Now, I'm talking about primary smoking, and I'm even talking about secondhand smoke. It basically chokes the skin. And if you're choking the skin, you can't get enough blood vessels to the oxygen to flow. You can't get a good circulation. You can't, and your skin looks dull and gray looking, and if you take the combination of sun and smoking and eliminate those two, the rest is fairly easy.
Oh my gosh.
Yeah, those are the two. Those are the two devils, and if you avoid the two devils, then you can often not need to do that much to get yourself to, because, as I said, the skin repairs itself.
Sure, of course. And that's surprising to me, actually, because, I quit smoking once, and now I've been off almost 9 months now, so I have no intention to go back. But what I find curious about what you're saying is I try to get enough outside sun time. So, of course, if I'm not smoking and I'm doing an adequate amount outside, there are still certain things, such as, for instance, like you prefaced and talked about how stress can be effective, or should I say non-effective in helping you in terms of your skin. And nutrition, I never think about it because I eat average, but I'm like, what does that have to do with your skin? I guess I don't really get the connection. You follow me? Like, how does that have anything to do with our skin?
Well, the skin is just another organ, and if you expect all of these other, anything that's good for the body is going to be good for the skin, basically, because that's the way you need to look at it. And the all the nutrients and everything else that you're trying to improve your body with, they all circulate through the skin. And they're important for nourishment, and they're important for keeping cell-related immunity and antibodies and all sorts of other things in the skin. So usually what's good for the body in terms of nutrients and vitamins is also good for the skin.
Nice, very nice. Now, as I mentioned, we'll kind of jump around to various different things here. As I understand, it wasn't so long ago, in fact, January of this year, you had held your Night of Beauty, which I noticed, where you had an event that you had put together where you gathered people together. I'm curious on how often you do these things. Now, are they open to the public, and what do they include? Tell the folks a little bit about the inception of the Night of Beauty and why you do it.
The purpose of the Night of Beauty is twofold. Number one is to discuss new procedures that have come out in dermatologic and cosmetic, usually non-invasive dermatology. Okay. And I've been doing these for a while, and people are always asking me in the practice, what's new, what's new, what's new? So either once or twice a year, we will just have basically a party, and we'll go over the Night of Beauty as to what's new and what's not new. And then the second thing is we discount our services on that night for people that are interested and who sign up for them. And some people wait 6 months until that night so they can come and sign up for other, things that they've wanted to do. Sure. Understandable completely. And do you find that they're successful? I mean, people walk away from it and they're learning new and different things, and they're able to have their eyes more wide open, so to speak. I would imagine it's just a plethora of education for the average person. Well, I do not leave the room or the premises until every question that they wanted is answered. And it's interesting what some of the questions are. A lot of the questions I expect, and a lot of questions I don't expect. And I just want to make sure that everybody one of the same reasons that I'm appearing today with you is that I'm sure there are questions that people want answered, and I'm sure there's things that they, not everything that you read on the Internet is 100% correct. There's a lot of so-called false news. And so I try to give them the skinny on what's out there, what really works, what doesn't work. There's a new phenomenon going on now where the drug and device people are actually doing direct-to-consumer advertising, and some of it is pretty close to factual, and some of it leaves a little to be desired. So I try to I think a good education for the patients and for people who are interested in procedures is very important. Oh, definitely, without a doubt. I want to kind of skip back for just a second to one of the comments you had made earlier in reference to tanning, because obviously there's a good number of my friends, more in the celebrity realm, of course, that tan themselves all year round, et cetera. And so I know I've heard them say on more than one occasion, like maybe it's just a facility that they go to that tells them in moderation, meaning if you're only going so many times a week and you're only doing it so often or certain, I'm not really familiar with it 100%. But I guess what I'm wondering is in moderation, is it still an issue? Meaning, are we still going to be affected by the suntan booth, for instance, even if we do it on and off versus a 5-day regimen or 7-day regimen? I'm going to give you a statement that you can go back to your friends and tell them that if they have a tan, they are damaging their skin. Period. That's it.
Wow.
Tan equals damage. If people want to look tan, they should get, there are wonderful bronzers out now. There are wonderful spray tans that you can do, artificial tans. If your skin is tan, you have damaged the skin. That's basically the bottom line. Wow.
That's amazing. Yeah, because I hear it all the time, and I think, oh, my God, they look so beautiful, and I envy them because I'm like, your body's great and they're tan. But hearing this, yeah, that kind of puts a big damper on things, to say the least.
Yeah, but wait till you see what they look like in 10 years.
I know, I'm afraid. Oh, God, that sounds terrible. My goodness. Well, now I understand that you have been in practice now for 36 years. You're located in New Jersey, obviously, which is relatively close to my home city of New York.
36 years have gone so fast. I tell you, I feel like it was yesterday. Uh-huh.
Now, this might sound like an ignorant question to you, but I'm a lay person who's not a medical professional, so I have to ask this because I'm like, I'm often pondering the question, okay, I knew I wanted to be a writer when I was 8 years old, and I knew eventually I'd make it a dream, and now it's flourished, fortunately, with a lot of hard work. I have a hard time imagining that a young boy at 8 or 10 or whatever age you were was like, yes, I want to be a skin doctor. Yeah, I mean, can you imagine? I mean, I wonder where that burning came from, where you're like, yeah, I want to deal with the skin and I want to treat people like that. Where did that all start or initiate from?
Well, it went in steps. I knew when I was young that I wanted to be a doctor. My ex-pediatrician used to tell a story of that I needed a ride home from someplace. It may have been a visit at his office, and he was doing a house call. So that's how long ago it was when pediatricians were doing house calls. And he pulls up to the residence, gets out of the car, and I get out of the car with him to go in. And he says, no. This is a house call. So I knew from a very young age that I wanted to become a doctor. The good question, follow-up, is why did you want to become a dermatologist rather than do all the other things? And the beauty of dermatology is that almost everything can be done by seeing what the problem is. And pattern recognition and the visuality of dermatology is what attracted me. And you can be very close to right in over 90% of the time just by looking at pattern recognition and by seeing what's going on. And that is what attracted me to dermatology.
Nice, very nice. Now, I'm curious to ask, obviously, because, of course, we all know that there's a personal side to a doctor, and he's not just a doctor 24/7. So do you have a family, meaning the children that have pursued the same line of work, et cetera? Would that be important to you, that this becomes more of a family sort of business?
That would be great. I have a lovely wife and 2 wonderful daughters, but one of them is not cannot really stand the sight of blood, and the other one wants to become and she's getting close, a pop musician. Her name is Lana Zach, Z-A-C-H, and neither one of them are interested in going into Dad's profession.
Really?
It would have been nice, but things work in strange ways.
And that does happen, as a matter of fact. I see that all of the time, and that's perfectly okay. Now, is that ever intimidating to? I mean, I've seen you before, but you're dad to them. Obviously, I looked at your picture for the first time, and I thought, oh my God, he scares me half to death. I'd be afraid to be in his office because you look very commanding, like a typical doctor, very serious, very commanding. And so I'm thinking to myself, do they just look at you as dad and not this big doctor I was on Good Morning? There's my dad on Good Morning America, because that's going to be kind of like, that's dad. You know what I mean? Do they recognize the whole professional side? Is that a little mind-blowing or surreal for them?
They recognize the whole professional side, but I can tell you that I still don't get the respect in terms of my daughter will go to the local CVS and pick up all sorts of dermatologic products without even asking me what to get. And and I'm just like a regular, it's even though I am a doctor, they don't really take my medical advice too seriously. So they respect me. They know that my accomplishments, but I'm treated like any other parental figure. That the parental advice is not always accepted.
I hear you. No, I get you, definitely. Now, I don't want to forget to ask, of course. So in terms of Lana, obviously you said she's becoming a pop singer. So to those that are listening in, including me, is there a way where we can find her music or listen to her or see her play?
She's just finishing an album. You could go on her Instagram, which is HIITS Hits by Lana.
Oh, my gosh, this is awesome. And just so you know, Lana, if you're listening in, yes, I'm going to hit up your Instagram and I'm going to ask you to come on my show because I interview musicians all the time. I'm a huge supporter of independent musicians and artists, and I'm more on the creative side, very non-medical. So I will talk to your daughter and beg her to come on my show because I think that's absolutely awesome. Congratulations to you on that. It sounds like
she's
an
young.
Absolutely
She's
beautiful
20.
family.
Just turned 20.
Oh, my God. Now, that is neat. Oh, my gosh, and young, too. We like that. Okay, awesome. Now, back to Dad, of course, because we do have to talk about Dad, obviously. Obviously, I started to mention, so we'll go back to that. I know that you've been on both The Doctors and Good Morning America. So talk to me a little bit about how you got presented that opportunity and the difference between consulting patients versus being in front of America, because I can imagine that experience on television is a little bit different for you versus the face-to-face contact you have every day.
Well, getting on the show was a factor that occurred because I treated one of the doctors who's on both of those shows. And she was so enthused with the treatment that I did for her, which happened to be the platelet-rich plasma to get hair to grow, that she said, we have to get this out there. The world needs to know about it. At the time that I did the first Doctors in Good Morning America, virtually nobody had heard of using your own blood to grow hair. And it went, the doctor's show, I was live on set, and I was a little bit nervous, but I had done other TV shows before, and I was there with my doctor/hostess patient. And Good Morning America was basically shot in 3 times in my office, so it wasn't really too stressful or anything like that. I'm sort of used to the TV camera now. You have to learn to speak in sound bites, and it's a different animal, but it doesn't really scare me.
I gotcha.
Sometimes when you get a patient in for a consultation who is asking a lot of questions and doesn't look too happy, that's a little bit more ferocious than the TV people do everything they can to try to make things good for you.
Oh, I'm sure. And in fact, when I had watched one of the segments that you did, one of the things that kind of rung in my head was, I wonder if the Dear Doc is going to think about maybe doing his own sort of tape segment, meaning that separate of the network, of course. So, for instance, let's say like a web series, or like some people go on YouTube and just do like maybe a monthly or a weekly sort of broadcast where you're talking about new and different topics. You'd be good for that. I don't know if you've ever thought of that.
I do have a YouTube. I'm sorry for interrupting. I do have a YouTube.
No, that's fine.
And I have done a lot of interviews with an English gentleman named Craig. That. And when things first come out, I do a bunch of interviews. And then I try to, in the office, tape some interviews with patients and things like that. So I do have my own website, but I don't do it as regularly as a lot of the other docs do.
Gotcha. I understand. Well, you're probably busy, obviously. I mean, and I get that, and that goes without saying. I just love it when professionals pass on their knowledge, obviously, to other individuals or to those of us in the community that actually need the help because we have certain conditions, obviously. That kind of goes without saying.
It's not only it's not only the patients and the lay people. This new treatment and injection technique that I developed, I either once or twice a month I go to different aspects of the country. Like, for instance, I'm going to be in Miami. I'm going to be in Las Vegas. Actually, I'm going to Las Vegas next weekend to educate doctors and PAs and all sorts of other people in this because they need the knowledge also.
Oh, of course, that goes without saying. I mean, certainly, the more knowledge you can pass on, I think knowledge is very powerful. And the more that we understand something, I think it's much easier to be able to cope and deal with it, obviously. Just so you folks know that are listening in, and you know this is your history, he went to medical school at Emory University, did his residency at Grady Memorial Hospital, and then, of course, Thomas Jefferson University Hospital. I talk a lot to my listeners because a lot of them are people that are kind of in flux and wondering, what should I do with my life? And so oftentimes I wanted to ask a doctor this, so we'll pose this question to you. It's an awful lot of that's an awful lot of hands-on time education-wise. A lot of us creatives spent time being educated, formally educated, but oftentimes life experience. So you being a seasoned doctor, have you learned more from a book sense or more from a hands-on sense? Or do you think it's integral for those that want to be a physician to utilize both skills as much as possible, meaning do the book work, do the homework in office?
It's actually both.
Okay.
You learn the amount of knowledge that medicine has when you graduate or you graduate your residency, and then you continue reading journals. But you need to learn a lot from your patients too. And if you're not paying attention and if you're not learning from your patients, then you're missing out on something big. So I think both are extremely important, because patients will teach you things that you just didn't expect or that you didn't learn in your formal education, and you need to incorporate a lot of those things into the way you practice medicine.
I would have to concur, just based on that's just it. A lot of times, oftentimes most of us as patients go to a doctor, and the most comfortable physicians that I've found that I work with well are those that communicate. They're very blunt. They know their business, and they care about their patients. That's a huge thing, and I think it's immensely important. I want to switch gears a little bit to talk about something called, I've never heard of cool sculpting before, and I know this only because I researched and I came across this concept. For those that are listening in that may not know, it's a way to reduce fat in targeted areas of the body. So what I would like you to do is talk to us a little bit about why you believe the concept of doing cool sculpting is healthy and helpful for us.
The question is an interesting question. It's helpful, whether or not, I would say it's not unhealthy, but the most important thing is that this treatment is really not intended for people that are grossly overweight, and I get people all the time who come in who are grossly overweight and they want to start doing this treatment. And for those of you who don't know what cool sculpting is, it's basically a technique where you chill down the fat and then it slowly melts away. Okay. And it works very efficiently. Approximately 30% of the fat each time you do a treatment goes away. But we do see a lot of people that come in that are at least 10, 15, 20 pounds more than their weight, and it's really not that good for that.
Okay.
It's the same thing with regular liposuction. It's really not intended as a weight reduction procedure. So the beauty of the cool sculpting is that it's non-invasive. You come in and we attach the device to you, and you sit now for 35 minutes per area, and then over the next 6 to 8 weeks, the fat just melts away. And the downside is it doesn't really hurt at the time, and you may have a tiny little bit of soreness, but it works very well. It's really the gold standard of non-invasive fat reduction. And I've been doing it for 5 or 6 years, and I have also tried it myself. I try a lot of these things myself just to make sure that what it's like, and so I can explain them to the patients. And it's really not painful and produces very nice results.
And is there, now this is a treatment, by the way, that's open to anyone, meaning that adults 18 to is there a certain bracket or a certain, is anyone out of
interesting question.
Can you eliminate it?
Will we treat people under the age of 18? I have treated 1 or 2 people under the age of 18. But it's not with a parental consent, yes.
Right, of course.
But it's not a regular treatment that we do for people under the age of 18. And there are people that you don't want to treat, people that have Raynaud's syndrome and people that are sensitive to cold, because it does get rid of the fat by chilling the fat down. And we do exclude some of those patients. However, most people, if their weight is within a reasonable realm of where their ideal body weight is supposed to be, then we can treat their candidates for treatment.
Very nice.
And initially we only treated the abdomen. Now there's all sorts of different locations that we can treat. We can treat arms, treat underneath the the chin. We can treat inner thighs. because as time has gone on, they've come up with different adapters that we use to attach to the fat, and the different adapters work well for different locations.
Very nice. Very nice. Thank you for describing that. And the only reason I asked is just because oftentimes we all assume, we go onto a website, we see this treatment, and we think, oh my God, this is going to be so perfect for me. And then you get to the doctor, and he's like, well, you have this condition, or you're that age, or whatever. So I just kind of want to set the parameter a little bit for folks that they understand when they walk into the doctor, hey, this may not necessarily be for you, even though it's out there and available, of course. So thank you for doing that.
I don't think there's an upper limit on age.
Okay.
The biggest concern is whether or not you have basically too much fat to be able to be treated by the technique.
Gotcha. I understand completely. Okay, now we want to talk about, before we start getting to the PRP procedure, et cetera, one of the things that I really think is neat is when we go to like for instance, I haven't been to your office as of yet. So what I'm curious about is I myself am thinking about going to see a dermatologist. So those that are listening in right now, and it wouldn't matter, I suppose, I'm in Wisconsin, but I go to New York. So let's say I come to your office and I knock on your door and I say to you, hey, what are some of the things that are most important that we should be watching out or looking for? Meaning, what's the precursor to one of us saying, besides obvious like myself, I have terrible dry skin everywhere. How do we know what the dermatologist can treat us for? Meaning, what sort of things can be happening within us or on us, et cetera, that kind of signal, yes, don't go to your primary, go to your dermatologist?
Well, we like to think that anything that happens on the skin is in the realm of dermatology, both cosmetic and non-cosmetic. So unless it's something really simple, we basically see everything, and we treat everything that's both cosmetic as well as medical on anything that occurs on the skin.
Gotcha. Okay, I see what you mean. Now, and the only reason I brought that up is, for instance, I had interviewed a chiropractor the other day, and believe it or not, obviously it's not limited to the neck or the back, that there's all sorts of other things they can see you for that aren't necessarily the traditional. Does that make sense? Like, traditionally, I have dry skin, I go see a dermatologist. There might have been things that you can treat, obviously, that may be a little bit outside of that realm. Does that make sense? I'm always looking for that extra sort of, he can do this too, or he can do this too sort of thing. Now, I find it rather fascinating that you hold 3 different patents for dermatology products. So if you wouldn't mind, can you talk about that? I guess I'm not sure what the patent process is. Is it okay for you to talk about the thing? Mm-hmm. Okay, great. I'd love for you to talk about the 3 different things that you developed, and then talk a little bit about, I have friends all the time that come up with things, and they're really not very familiar with the patent process. So we're curious how difficult it is to get something patented as well.
It's difficult to get things patented, and the reason it is difficult is because there's so much paperwork involved in order to get the patent to go through. You really have to go through, you have to show that what you are proposing is a novel idea and is not something that would just be obvious. Okay, that's the obviousness. Sure. And then the other thing you have to show is that it works and that it's functional. So you have to get a patent lawyer most of the times, although you can just send in a preliminary patent and then go for a complete patent with a patent lawyer. But that becomes an expense, number one. And the patent lawyer has to be good. Unfortunately, one of the patent lawyers that I used wasn't good, and it ended up hurting me in the long run.
Oh, no.
I invented something that is being used worldwide now, and because the patent wasn't written correctly, I was never able to enforce the patent, which is I developed an at-home chemical peel that involved peeling pads. And if you go to any Sephora or any store now, and you look at salicylic acid or glycolic acid pads, which is there's a million of them that are used to peel the face. That really came under my patent, which 15, 20 years ago, proposing to do a chemical peel in one's home was heresy. But I foresaw that this was going to be something that would have value, because the at-home usage of all different sorts of devices and products is increasing tremendously. So I came up with that patent, but I didn't have such a great patent lawyer. And Neutrogena and every one of the companies just ripped off my patent.
Oh, my God.
So
I'm so
for
sorry.
those of you who are thinking about it, make sure you get yourself a good patent lawyer. And that's why even you need someone who knows what they're doing. So that was my first patent, which was developing an at-home chemical peel. Then I also developed a patent for, so as I'm telling you the patents I developed, I'm telling you the saga that goes with each one. The second one is I developed a patent to treat stretch marks. So I developed a cream that treated stretch marks. Okay. And it worked great, and I thought, and the patent was actually pretty good on this one, but the problem is, even after you do all these things, if you're trying to do something to monetize it, you have to have enough money and enough, let's say, people behind you in order to bring the thing to market. And we could not get my stretch mark cream to market. We tried all different locations, all different things. We could not get it to market. Okay. So I'm still selling it in my office, and some other doctors are selling it too. And it works great, but it never got to the market. And then I also developed a more esoteric product, which was a special combination to treat dandruff and psoriasis in the scalp. Okay. And there really wasn't that much of a market for that product, although the stretch mark market was a huge market. The psoriasis and the other market wasn't that great, so we really never could get anybody to pick up my formulation. And all three of my patents, which I thought were really excellent patents, never really amounted to much in terms of success outside of my office.
Well, folks, that means you have to go to New Jersey and go buy his products. That's what the bottom line on that one is. Because if you can people literally do that, by the way? I mean, I obviously know that you have a steady stream of patients, etc. But if somebody is interested in decide, hey, okay, they can. Okay, so that's not an issue. Okay, just want to clarify on that one, obviously. Now, I understand, of course, that you serve as the Emeritus Chief of Dermatology at Holy Name Hospital. So I want to talk about this concept a little bit because we just had a conversation with a fellow doctor a few weeks ago. So I'm curious about your take on this because you obviously do office practice. You obviously go to the hospital, and I presume that you obviously do that regularly enough to be able to speak to this. We're noticing here, and I'm curious on your take on this, like here in Wisconsin, some of the doctors that used to treat my child no longer they're not on staff in Children's Hospital anymore. They don't have privileges anymore. And so some of us here, meaning the patient side of things, we get concerned about the fact that we can no longer be treated by our own physicians at our own clinics and or hospitals, et cetera. Is that something in your area that continues to be an issue? I guess I'm just wondering or trying to find out why it is that hospitals are kind of stemming away from that.
I make this very simple for you. That's nationwide.
Oh,
and it's called It's called network narrowing. That's the euphemism for it. And basically, what's happened is the following: the doctors at your daughter's children's hospital were probably given an option: either you can join, be a staff employed doctor, or you can lose your privileges, and that's what happens. So if they're not willing to become staff doctors at a considerable loss in pay, then the hospital doesn't want them around and will not let them continue with their privileges there. Now, the same thing happens with managed care. And this is what even I read what the Republicans are, one of their concepts, the way that they want to reduce the cost of health care is that they want to allow the big insurance companies to narrow their networks. And what that means is that they will select which doctors will stay in the network. And basically what they're going to accept is two things. One's that will take less money, that's number one, or those that are extremely cost effective. Now, sometimes cost effective means that you're able to get to the same end result by spending less, and sometimes cost-effective means that you just don't do all the tests and other things that you need to do. So what's happening as we see medicine becoming more governmentally influenced, and we see large hospitals with more influence, is that the doctor is getting squeezed. And this is why you're not seeing your regular doctors in these locations. You're not seeing the doctors in certain plans because they're not allowed to be there. They're being thrown out.
Oh, my God, that's awful. That's kind of what I suspected. That's what we all assumed to some certain extent, but clearly the patient-physician relationship is pertinent, I believe, to proper and appropriate health care. It's fundamentally important to some of us, clearly.
Well, the thing that President Obama said, which is you're going to be able to keep your doctor, is totally not true. It's just not true. And the pressure is overwhelming from these insurance companies to conform to what they want you to do. And from hospitals also. Hospitals are buying out of primary care practices, and if you're not willing to join their group, then they don't want you.
I gotcha. I understand. I want to jump back a bit when you were talking about the products because, of course, obviously I want to just real quickly tweak your mind if I could because, obviously, I'm a human and I have children. So this is one thing that's been driving me nuts. I have a son. He's 12 years old. And he started now getting this whole acne thing. And it's driving me nuts. Well, first of all, it's not everywhere, by the way. It literally is predominantly on the forehead. So I took him to his primary care physician, of course, because I'm a mom. So we go to the pediatrician, and he's like, no, he's not cleaning up well enough, meaning he's not scrubbing in the right places, blah, 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 have him clean better, blah, blah, blah. We tried the soap and all that stuff. We just tried this Neutrogena, forgive me. It's a Neutrogena product that I know for sure. But, he's just breaking out all over. And I'm thinking to myself, okay, do I need to change his diet? Do I need to, is this just, I remember when I was 12 this happened. But I guess since you are here, I may as well ask you, is Mommy not doing something or not doing enough? Or is this just, we're out of luck and it's an age
There's a couple of things boxes that you need to check and go over. Okay. First of all, is there a family history of acne? If there's a family history of acne, then it's probably pretty normal that he's going to have acne. Second of all, does he use any mousse or hairspray on his scalp? Because if he uses a lot of mousse or hairspray, that gets on the face and can cause acne. Having said that, most of the time the acne is normal, for a 12-year-old who was entering adolescence. And the single best product for you and all your listeners is to go out and buy benzoyl peroxide. It's available over the counter. A lot of the different companies make it. And use that benzoyl peroxide once a day, very sparingly, and over the period of 2 to 3 weeks, the acne should come under control. If the acne does not come under control after 2 to 3 weeks, and I would use a mild soap with that, then your next step is to go to a dermatologist. But that will handle 60, 70, 80% of the people.
Wonderful. We don't want to forget to talk about this either because even though, yes, folks, it's only mid-February, it only takes a couple bit of months before more of the sun comes out and we start having to worry about skin management. So just off the top of your head, as we start approaching spring/summer season, all of us are always looking at the whole, we have to buy a suntan lotion. It's SP this much, and we're always kind of trained for certain habits. So can you maybe throw a suggestion out there as the season starts to change here a little bit in terms of proper skin care, whether it's when we go swimming or whether we go suntanning? Any great suggestion for all of us to keep ourselves highly protected?
It's different for kids than it is for adults.
Okay.
I'm a big believer in keeping the amount of chemicals down, especially in kids.
Okay.
So, and the second thing I want to mention is that if you read certain publications, they'll tell you an SPF of 15 is adequate or an SPF of 30 is adequate. The problem is that those SPF numbers were calculated by using a certain amount of sunscreen, and nobody ever uses the amount of sunscreen that the number was calculated on. So most dermatologists will tell you to get an SPF of 50 or higher because you're only going to use a small amount, and a small amount of a 50 is equivalent to a 15 or a 20.
Gotcha.
So I would recommend high numbers, and I always recommend mineral sunscreens because
Okay.
They have no chemicals in them. And they have zinc and titanium, and they just don't have the chemicals in them. And the beauty of those are that you're not going to absorb the chemicals, and they're safer, and that's where I usually go. There's a lot of good chemical sunscreens, but I'm not really a fan of using chemicals.
Understood. Gotcha. Now, to you folks that are listening in case you might be wondering, well, how does this guy know what he's talking about? Well, it's not just myself, along with all sorts of other people that have been treated by him. A couple quick facts. He has been named Top Beauty Doctor by Savvy Magazine. He has been listed as the top New York doctor by Castle Conley, and he's also been elected to the Who's Who in America. That right there, that in and of itself says something, but the fact, of course, in addition to the patents, the number of patients that he possesses, etc., he has also come up with what we call the PRP procedure, which is your procedure, and what I love about this, first off, is it's a non-surgical procedure, which most of us love hearing, especially those of us like me who can't stand needles, etc. I would like you to first of all talk about where this came from in your brain. How did you come up with something non-surgical that's able to help people with this?
Well, first, let me correct you. If you're going to consider injections with needles surgical, then you have to put this in the surgical category because I will get in.
Okay.
You do need a needle to put this in. But let me give you a little rundown. First of all, I didn't really invent this. What I did was I modified the technique of delivering the PRP and so that it was more effective, less painful, and could be done in a shorter period of time. So here's the way the story goes. In the early 2000s, in Europe, they were using patients' own blood, spinning it down and getting the platelets and using it to get hair to grow. It wasn't into really early 2012 that any articles appeared in the dermatology literature. And I read an article in the dermatology literature that said that they had people who were men and women who were losing their hair, and they did some studies on them. Once again, not in the United States, in Europe, and 61 out of 62 people who got their own platelets injected into their scalp either grew hair or decreased the amount of hair that they were losing. And I read this about 3 or 4 times. I said, this is really phenomenal if this is true. Nobody really picked up on this too much. So I started first experimenting with my family, and I tried myself, and I saw that it really worked. So then after it really worked, when I treated Dr. Jennifer Ashton, who's on The Doctors and who's on Good Morning America, and she saw that it really worked, so then we got on and we were able to take it more mainstream. The difference between the PRP that the way that I developed it and the way that it was done before is for years they used to do something called microneedling, which some of your listeners may know is a technique that's often associated with facialists or estheticians where they microneedle the skin on the face to make it look better. And they were microneedling with tiny little needles and then putting the PRP onto the scalp, or they were taking and injecting the PRP into the top layer into the skin. And to me, after I reviewed all this, it made no sense because the part of the hair follicle that really has the activity is the bulb, and the bulb is not in the skin, it's in the fat below the skin. So I started working on a different injection technique and a different way a different level and a different way so you needed less injections. It used to be very, I wouldn't say very, but painful enough that you used to have to anesthetize the whole scalp with lidocaine, and it would be swollen for a couple days and people's eyes would be shut, etc. So I said, well, there has to be a better way to do this. And I developed a better way to do it by injecting below the skin, by using larger amounts with less injections and getting it to diffuse because the plane that it's at allows the platelet granules and the growth factors to spread where the other ones were stuck in the spot where you injected it, and therefore you needed to do more injections. And this new injection technique, which was just written up in one of the magazines, and I have another one coming out too, seems to be much simpler, and it seems to be at least as effective, if not more. I don't want to say because we haven't done head-to-head comparisons, but it does work very well.
Right.
And a lot of people are now adapting using my injection technique, and that is how the PRP is expanding nationwide amongst aesthetic physicians and even what are they called, metaesthetic physicians.
Gotcha. I understand. Now, if I get this correctly, I just want to confirm a couple of things as it relates to the procedure itself. So if you could give an approximate, let's say somebody comes to you and says they want to have this procedure done. Is there a prep involved? Is it a lengthy procedure? Any after effects?
Let me tell you that it's very important that you evaluate the patient. If someone comes in and they say you want it done, that's not the best way to help your patient. You have to do an examination. You have to do a history. You have to figure out why is the patient losing hair. Now, with men, it's fairly easy. 95% of the hair loss in men is inherited, and inherited hair loss in men responds fairly well to PRP. Women are a different situation. Women have what's called multifactorial hair loss in a lot of people, and that means that they have multiple reasons for hair loss. Now, the PRP works best in those that have a genetically disposed hair loss. For people that have all these other hair loss indications, it may not work as well. So, and then there are some that it won't work on at all. There are people with different types of hair diseases that it won't work on at all. So It's extremely important to go to somebody knowledgeable to be able to see, especially if you're female, as to whether or not you're a good candidate or not. If you're not a good candidate, it doesn't make a difference how many injections you get. It's still not going to work well. And it's very important that you have it evaluated by someone who knows what they're doing.
Okay, I gotcha. Now, as I understand this correctly, this procedure is also used in other fields as well, meaning like neurosurgery or oral surgery, et cetera. So this is not something that just came out last week. Okay, gotcha.
Yes. It was used in all the other fields prior to. And the only field that is, the device that we use is FDA approved, but the indication of taking the plasma and the platelets and injecting it into the scalp is not FDA approved. The only subspecialty, you want to ask me something about that?
Well, yeah, I'm curious about this. And I say this more so for my listeners, because if I'm asking myself this, my guess is the people listening in are asking themselves the same thing. Because I understand how FDA approval works to some extent, so I guess what I'm wondering is, how is it that not all of that needs FDA approval? Do you follow me?
A physician can use his own discretion to treat a patient if he feels it will be helpful with any medication, even if it's not FDA approved.
Gotcha.
So as long as you're not doing something that's just out in left field, you can basically do it any way that you want to do it. The machine to produce the plasma is FDA approved. Taking the plasma and injecting it into the scalp is not FDA approved. And that's why you won't see commercials and advertising from the people that make the machine about using it to put into hair. Now, the one indication that it is FDA approved for is in orthopedics for bone surgery. So it is FDA approved for bone surgery. Now, one tube of platelet-rich plasma does not equal another tube of platelet-rich plasma. The PRP that's obtained for use in orthopedics has a lot more red cells and white cells than the tubes that we use in dermatology, and there's a reason for that, because the one that is for orthopedics, the orthopedics want an inflammation in the place they inject it. So they put it, so the red cells and the white cells are there, and it causes an inflammatory response, which causes the cells that eat up dead tissue to get rid of the old dead tissue. When we are injecting in the scalp, we don't want inflammation because inflammation is our enemy. So one PRP does not equal another PRP.
Got it. Okay, that makes sense. At least I can follow that as far as that goes. Now, if I were to ask you, because you are the physician, so let's just take it a step further, which is if you're speaking to your listening audience, tell them why you believe that the PRP procedure is most important for them to utilize versus, let's say, another procedure or another type of surgery out there, et cetera. What is the biggest bonus of using PRP, in your opinion?
It works. It works. And the reason that the reason that this has been such a big advance is that I've had women come to me and men come to me. Men had more options than women, by the way, and they've come to me and said, I've been losing my hair for the longest period of time, and there's nothing. Every doctor I went to said there's nothing I could do for them. And basically that was true. There was nothing else to do. For men, there is FDA-approved minoxidil, and also for women, and there's something called Propecia, which is FDA-approved. But there's really nothing that has been as effective, especially for women, and has given superior results for men than PRP. So because of its ability to produce a good response, that's why people are seeking to have the procedure done.
Nice, very nice. And just to give us some background, how long have you been performing this? And would you say that the success rate, if you had to throw a percentage out there, if there is such a thing, give us some ballpark idea on what we're looking at.
You know, here's what I'm going to tell you. I've treated over 1,000 patients with this procedure in over 2 years. Out of the 1,000 patients that I've treated, I would say we probably have a success rate of about 80%, 80 to 85%.
Okay.
But success can be determined a lot of different ways, and I'm going to tell you what sort of results you can expect and what sort of results you can see from PRP. And if you understand the spectrum, then you can decide if you're. Let me give you an example.
Sure.
Almost everybody that does PRP, if they're normally shedding their hair, okay, the amount of shedding will decrease. So if you were losing 150 hairs a day or 100 hairs a day, it'll go down to 10, 15, or 20 hairs. Okay, so if you want to view that as success, we're over 90%. The next thing that's going to happen is that the hair is going to grow faster. It's going to keep it in the growth phase. So you'll need to get your hair cut more, and it'll also grow thicker, which means that if you had hair breakage or if you look like you have a low volume and your hair is not thick enough on your scalp, it will grow thicker. That's like 85 or 90% also. Now, the real question comes is how much regrowth are you actually going to get from this particular treatment? And regrowth is the hardest thing to predict. And in my experience, regrowth has a lot to do with how long the area that you want to treat has been without hair. If it's been longer than 5 years, it's hard to get the hair to regrow. If it's less than 5 years, between 3 and 5 years, it's questionable. If it's less than 5 years, the regrowth is you have a much higher chance of getting regrowth.
Okay, I gotcha.
Studies have shown that regrowth can happen anywhere from 4 to 12 months after you start it. So I have some people that after 4 months they start seeing regrowth. I have some people, and there was a study out of France that takes at least 8 or 9 months before you're going to start seeing regrowth. So everybody's different. So if you want to evaluate success by those different categories, the percentages change.
Nice. Okay, I see what you're talking about. And this might be just an assumption based upon the people that I know, et cetera, but would you venture to guess, I'm going to assume, and you can clarify one way or the other here, would this be more of an issue in terms of the actual hair loss, et cetera? Do you find this to be more prevalent nowadays in men, or is this something that honestly is equal gender?
The hair loss or the patients that come in, which is the question?
No, I would say probably the hair loss, because honestly, one of the biggest things that I think we worry about, men, women, or otherwise, is not only, I think for women it's graying and for men it's loss. But you're going to confirm that one way or the other right now.
The numbers show that the hair loss percentage is higher in men. That's what the numbers show. By not much, by 10 or 15%. So the hair loss percentage is higher in men than it is in women. So in other words, if you take women 50 and men 50, the men at 50 have a higher percentage of hair loss than women at the same age. Although both do have percentages of hair loss, but it's higher for men than it is for women.
Understand. Gotcha. Now, one of the other things that I don't want to forget to mention to people is I understand it because I'm going to guess, and I know that it's been stated, I think, on your website or elsewhere, sometimes it can be difficult for insurance companies to cover the costs of certain procedures, et cetera. So as I understand it, you indicated that you actually work with finance companies to help cover these services. So I thought it was important that you explain that, yes, it is possible that you're able to get some things done, or in fact, I guess I should ask, is the PRP a procedure that's commonly covered?
The problem with PRP is that the insurance companies consider it cosmetic. They don't really, I have some women who are post-chemotherapy, okay, and they've lost their hair, and we'll recommend the injections, and the insurance companies don't want anything to do with it. They'll pay for wigs, but they don't want to cover using PRP for any indication because they consider it to be cosmetic. And then the other thing is, because the FDA has only approved the technique but not the indication, they use that as an excuse not to pay for it. So although you can get insurance to cover your injections into your tendons and into your joint space, you can't get insurance companies to pay for injections into your scalp.
Okay, I see. Hence the finance company aspect, I would presume. And is that relatively challenging? I guess obviously every case is going to be different, but I just want to leave people with the idea here that, yes, there is indeed hope, actually, that if this is something that you need or if something needs to be done, that it is possible and that they're not going to necessarily have to go broke by having procedures such as that.
And I can tell you that of the prices that I've seen around the country, ours are probably some of the lowest prices that we have. Our prices are $400 a session if you need one vial, and $600 a session if you need two vials. Most of the in the New York metropolitan area is at least double or triple that, and throughout the country. So I purposely try to keep my prices low so make it available to people who could not afford it otherwise.
Nice. Very nice. We'd like to hear that, definitely. Wonderful. Well, I want to do a run-through here. If you wouldn't mind, Doctor, I'm just going to list all the various different ways that folks can find you because it's important to list these. So I'm going to list off every place that I found you on social media, and then when I'm finished, please correct me and just let me know if I finished anything or forgotten anything. I'm okay. So here goes the rundown. His name, folks, just so you know, it's Dr. Jeffrey, and Rapaport is spelled R-A-P-A-P-O-R-T. Following websites he can be found on: www.prphairmd.com, cosmeticskin.com, Rapaport, and that's R-A-P-A-P-O-R-T.com. He has a Facebook page, which is Jeffrey Rapaport, MD, which is the name of it. Another website he can be found on is Cool Sculpting New Jersey, which is NJ.com. The Twitter handle is @Jeff Rapaport, MD. On Instagram as Dr. Jeffrey Rapaport. He is also on Google Plus and YouTube. Have I forgotten anything?
No, you did a great job.
So that's a whole lot. Well, you know, journalists are kind of like doctors. We are very particular about details and all that other good stuff. I don't want to forget to mention two quick things here, just so that you know, to your patients and to your fans and followers, within about 2 hours from now, the show will be archived. So people can go back to Blog Talk Radio at any given point in time, and I'll forward the link, of course. They can go back, they can listen to this interview. Obviously, people on my social media, along with all my other sites, will be able to see this as well. I don't want to forget the most important thing, which is if anybody's listening today, they want either your procedures, your attention, a consultation, etc., we should probably check to make sure you're still taking patients, the easiest way for them to get access to you, etc. So this way they know if they're in the New Jersey or New York area, they can come to you.
The easiest way to do it is just to call the office. I have a concierge that handles all the hair people and all the cosmetic dermatology people, and her name is Debbie, and try the phone number for the office, which is 201-227-1555, and just ask for Debbie. She's not going to be there today because we have a bad snow condition here in the Northeast, and I think they left early. But if you start on Monday at 9 o'clock at 201-227-1555 and ask for Debbie, she answers all the questions, etc. And a lot of times we'll have people email us pictures and things. Hair consults are harder to do with pictures, but other types of consultations we do with pictures, and we try to make ourselves available.
Oh, that's absolutely wonderful. And do you also happen to do any upcoming events or lectures, seminars, places that you're going to be at if people just want to meet you?
But I have a lot of lectures coming up. As a matter of fact, I was just looking at my schedule. But you have to be a healthcare professional in order to be able to attend these procedures. I'm going to be in Las Vegas next weekend. I'm going to be in Miami April 1st, Los Angeles. But if you have healthcare professionals that are listening, they can come.
Oh, wonderful. Absolutely. Because I know a bunch of different ones and I can pass the information along to. And I might be in Vegas next weekend. I'm not going to quote. It's possible. I'm working on it right now, but I don't know for sure. And if I am, where will you be? Oh, wait, I can't go. I'm not a medical professional. Duh.
No,
I'll just come and see you. I can't do that.
This is the inaugural meeting of the Metaesthetic Leadership Boot Camp, and I'm going to be giving the keynote lecture on that. And these are all people who are in the medical aesthetic business, but they have to have some sort. They have to either be an esthetician or they have to be a medical assistant or some sort of medical person.
Understood.
And then what I'm going to do is that my website is going to have a list of all my appearances for people. As of right now, I think I have about 14 for the rest of the year.
Wonderful. That sounds terrific. My goodness. Well, I have to tell you, Doctor, not only do I feel more intelligent and more educated, but now I'm just intrigued to stop and knock at your door when I'm in New Jersey. Not that happens often. I'm more a New York type girl, but definitely.
Well,
and I wish you lots of luck with this.
We're only 6 minutes from the George Washington Bridge, and it'd be my pleasure
to meet
you.
Oh, my God.
I would totally,
absolutely love it. That would be terrific. And I'm so glad that you were able to take the time. I know it's very difficult for doctors to try to squeeze things in like this. So I appreciate it. And it's been absolutely wonderful. And you've given me a much better understanding about skin and how we should take care of ourselves. And you are fundamentally important. And you are highly, highly, I told you, this is why I was nervous. You're a wonderful guy with some great credentials. And if there's anything I can do to ever help you and you want to come back on again, promote something else, my door is open to you at any time.
Thank you.
All right, my dear. You have a wonderful weekend. Anytime.
You too.
Take care.
All right. Take care.
Wasn't he amazing, right? I mean, talk about knowing your stuff. And I mean, not only knowing his stuff, but he is educated, he is intelligent, and he is also informational. And I absolutely love it when clients come on and they're able to talk about other people's conditions in such a way where we can find some hope and some help and try some non-surgical invasion in non-surgical, non-invasive procedures. See, I'm talking ahead of myself this week. That's because I'm tired and it's Friday and I just want to go home. Which can. Okay, so my special thanks one more time to Dr. Jeffrey Rapaport. I'm going to go through all the ways you can find him. Websites are as follows: www.prphairmd.com, cosmeticskin.com, jrapaport.com, and coolsculptingnj.com, which is a procedure we was talking about earlier in the interview. He is on Facebook, and that is Jeffrey Rapaport, MD. The Twitter handle is @JeffRapaportMD. His Instagram, Dr. Jeffrey Rapaport, and he is also on YouTube and Google+. So, yes, and as far as that goes, as you heard, the PRP procedure is something that not only he implements, but he works with you in terms of getting it financed and taken care of, so we're not going to our grave owing bills for such a procedure. I do not want to forget, as always, Valerie Pierre-Cadet with Social Minded Media Group. If you have any PR needs, she's a girl you should be looking up. First of all, she's a New Yorker. Second of all, cute as a button. One of the most highly professional publicists that I get a chance to work with on a regular basis. So to you, my dear Valerie, once again, for the third, fourth, I can't even remember how many interviews this is now. Thank you so much for bringing me such an informed and intelligent individual to my show. I always look forward to having your clients because they really are top-notch. So thank you for the gift of you as well as the gift of your clients. More appreciated than you know. Want to remind everybody one more time before I forget. Next week, I will be on air starting let me look, day before Valentine's Day, and yes, I'm taking off, no show on Valentine's Day. Yeah, that's right, I couldn't get Michael Madsen to come on the show. Don't hate, I tried. So, Monday, we're going to be having Dr. Stacy Radin on our show at 1 p.m. Central Standard Time, so tune in for that. Wednesday, February 15th, Harley Flanagan. To those that are the bikers in the club, you're going to want to listen in for that. He's not only a bike enthusiast, but he's also a musician. Harley Flanagan, 12 o'clock Central Standard Time, Wednesday the 15th. On the 16th, we have Veterans Helping Veterans. Very, very important show, 4 o'clock Central Standard Time. Bob and I are going to be sitting down and talking about how veterans are taking their time, their money, and their efforts to provide other veterans home in the Milwaukee area. Hugely important that you listen in, and that would be at 4 o'clock on February 16th, which would be after the induction ceremony for Judge Gene Keith. So excited to be attending at Milwaukee Municipal Court. And then, of course, Friday we'll round out the show. Noon, Bob Siriano is coming on. That's all I'm going to say. Hugely talented musician, 12 o'clock Central Standard Time on the 17th. So just to reiterate, I'm on air 4 out of 5 days next week, folks. My wish for you this weekend, stay out of the cold. Have a wonderful, wonderful weekend. Thank you so much for listening in and making me part of your day. You take care, and I'll talk to you next week.
All you need is love. We love the beat bugs. And Target is the only place you can find them and all their gear. Come join the fun and jam with us. Love is all you need. All you need is love. The beat bugs rock. Did you know you can only find their gear at Target? It's true. So hurry over. All you need is love. Love. Love is all you need.